I think the biggest presentation that we were all eagerly awaiting and that we came away was practice changing was, I believe, Thursday morning on the presentation of the RxPONDER clinical trial by Dr. Kalinski. So this trial took patients with hormone receptor positive breast cancer whose lymph nodes were also positive, so 1 to 3 lymph nodes, and asked the question of do they need chemotherapy or not, based on the Oncotype DX score. This is a score that's generated based on tissue taken from a patient's biopsy sample or surgical sample that ultimately tells us what is the chance of this cancer recurring in a distant location over the next decade or so, and what's the likelihood that chemotherapy is to alter this risk. Based on TAILORx data previously, this, a couple of years ago, changed our practice and localized breast cancer without lymph node involvement, in that we know those with lower scores do not benefit from chemotherapy. So we can spare a lot of women from chemotherapy. This too confirmed that in the postmenopausal patients, and those generally greater than 50, with a low score, less than 25, that they can be spared from chemotherapy if they have 1 to 3 lymph nodes and, again, a low score. Now, in the premenopausal patients, or those younger than 50, they did not show that. So there seems to be some role for considering chemotherapy, and that was seen whether the score was lower or higher. One, I think, point of discussion in the field, and different people sort of have different opinions, on where they stand in the spectrum, is the benefit of chemotherapy in the younger patients. The fact that we're seeing this age difference, is it less about the chemotherapy and more that it puts them into premature menopause? And if that's the case, can we replace chemotherapy by suppressing their ovaries through, medically, and essentially putting them in menopause and treat them just with anti-hormone agents and forego the chemotherapy altogether? I think the verdict's out. That trial hasn't been done. And I think in the meantime, each physician sort of on a case-by-case basis will consider for their younger patients chemotherapy, or maybe in select cases consider to forego chemo, maybe offer ovarian suppression. But the big take home from this presentation was, especially in the postmenopausal patients with limited lymph node involvement and a lower score, we can comfortably, I think, forego chemotherapy in the majority of them.